Good morning and welcome to Windsor-Essex County Health Unit's media briefing for Thursday, January the 6th. This morning, we will move right into media questions, which will be answered by CEO Nicole Dupuis and our Acting Medical Officer of Health, Dr. Shankar Nasathuri. For questions this morning, we will start with CTV.
Good morning. Just wondering if you have any idea of when you will get an accurate picture of the variants in the community, or specifically Omicron. On the website, it lists 8 cases, but yet you think it's the dominant variant. How do you kind of gauge how widespread it is in the community when the reporting is delayed?
You want me to
Go
start?
ahead, Nicole, I can supplement if you'd like. So
Sure. I was just going to actually, that's one of the indicators. It's a good question, and it is one of the indicators that we have tried to report in the past that will likely be moving away from reporting on our website. As you noted, there is a delay, and it is our understanding that because it is presumed to be the predominant variant, and that the actual screening, et cetera, that process won't be occurring the same way it had in the past. So we won't really have that information to report or differentiate. And at the end of the day, it's not a really accurate indicator for us to look at. So it is something we're looking at removing in our updates to what we're reporting.
yeah, I think we're working under the assumption now, based on what we understand, the prevalence of disease, that virtually everybody, or the vast majority of the people being infected, have Omicron, and we're using that as the strategic approach moving forward. I think in part it relates to what resources the province wants to allocate for testing and how the testing strategy can be formulated. But at this point, we're working on that assumption that the vast majority of people who are testing positive have the Omicron variant.
Okay, thank you. Now, just a question about the booster for the individuals that are getting the 3rd dose of vaccine. Is it a half dose of Moderna or a half dose of Pfizer, or is it a full dose for the 3rd shot?
Sorry, could you repeat that?
Sure. Just was wondering if the booster shot's the 3rd dose, if it's a half dose of Moderna or Pfizer, if it is a full dose.
So for Moderna, if individuals are over the age of 70, it's a full dose, and it's a half dose if they're under the age of 70. And Pfizer, I'd have to, Dr. Nasathuri may know, I believe it's the same, but I'll have to, not the same as Moderna. I believe it's the regular dose, but I'll have to double check.
Yeah, there's no dose modulation based on age for Pfizer, but for Moderna, people over 70 get the full dose, and people under 70 get half dose. The key issue here is not half dose or full dose. The key issue is that what dose do you give to give a sufficient protection from infection, and it's based on the understanding that older people probably need a larger dose of the antigen to provide the protection.
Okay, thank you.
Any questions from CBC?
Yes. When can people turning 18 this year start booking their booster shots? And what about kids turning 5 this year? When can they start booking those first doses?
So, I mean, the rule is that you have to be that age when at the time of your appointment. So you would need to be 5 on the day of your booked appointment, and you would need to be 18 on the day of your booked appointment.
Thank you. And yesterday we had another opioid overdose alert for the region. Could you provide us with any comments about that?
We don't really have any specific comments other than what has been put out in the alert. Again, I know we've talked about this a number of times this year. we're increasingly this year, we've seen, a real alarming rise in the number of alerts that we're putting out, the number of overdoses that we have seen. And again, always our message is, not to use alone, to make sure that everyone has an naloxone kit, and certainly to share where you can obtain a naloxone kit. So if you go to our WeCost website, participating organizations that are handing out or giving naloxone kits are listed there, as well. Participating pharmacies are all listed on the WeCost website. So I think the important message that we would always share is to make sure that anyone, pretty much every household should have a naloxone kit. And I'm sure Dr. Ness, if there you may want to add.
Sure, we can always get to the exact data, but the last time I looked at the numbers, I think there are 2,500 people who died of opioid overdose in the province in the last 12-month period. That's many times more than the number of people who die in car crashes. I think the number of people who die in car crashes in the province every year is around 600. So the opioid crisis continues, notwithstanding the pandemic that we're also trying to address. I think that the one thing that everyone can do is to get an naloxone kit if there's any possibility that someone in your household might be consuming opioids or illicit opioids. A number of people who do die at home, and if an naloxone is available at home, perhaps some of those lives could be saved. Second issue is, and I think it's worth for us to think about this, is that the health district and the community overall has put forward a proposal for a safe consumption site. The safe consumption site is one additional step to try to mitigate the effects of opioid use and opioid misuse. And we look forward to at the Public Health Service to having that site open, as it'll be one additional step that we can do to help protect the community.
And I apologize, I know we touched on this before, but any sense of when that site might be ready, or what's the update for the process right now?
Yeah, so I think I know we were asked about it just before the holidays. We had hoped to, be further along at this point, but we do require, as we've said, we do require approval or a support letter from the municipality. We hope to go to council before the holidays, but at this point in time, we believe that we're set for, I think the date is January 17th. So where we'll, request and speak to council, request that approval. And once that happens, once we have the approval, we'll be able to finalize the application and submit it both for the medical exemption to Health Canada, as well as the application to the province of Ontario. And then, from there, we'll have to wait for, that approval process, which, we don't really have a clear timeline on that, but it could take, several months, and then, and then several months from there to get the site ready. So, we're eager to get going.
Yeah, I could share that there should be, and there is, a sense of urgency in moving forward with this. It is something that would benefit the community. Opioid use and misuse affects the community broadly, and not just certain segments of the society. I know that from personal knowledge, to the extent that we have inferences on the people who might be affected by it. I think that it's really incumbent to move forward to get the approvals from the municipality, and we remain optimistic that those approvals will be forthcoming, so that we can move on to the next steps to get approval for a safe consumption site.
Great. Any questions from Blackburn?
Yes, I was missing time yesterday, so I'll ask you the same question today. We do have an epi summary today coming down, correct?
Yes.
Okay, good. Did anything stand out from that summary that you saw so far?
Well, I think a couple of things. One is that numerically the burden of disease across the province is significant. Secondly, I think in moving forward, we have to be the metrics that we use, such as case count and percentage positivity, are not as valuable in gaining insights into the burden of disease because testing capacity is more restricted at the current time. I think it's important to follow other metrics that might give us inferences into local burden of disease, including the number of people hospitalized, the number of people in the intensive care unit, the number of people on a ventilator, the number of people who died, and the number of absenteeisms or the percentage of absenteeism from certain employers. Those are all items that I think in the future we'll have to look at moving forward. If I could share this as a general observation, I think when we spoke to hospital officials yesterday, there are about, we can try to give you an exact number, but there are about 50 people currently hospitalized in the health district with COVID or COVID suspected symptoms. That's in a health system that has many hundreds of beds. I think Windsor Regional Hospital has 600 beds, or approximately 600 beds. What this tells us is one of the inferences that we can make from this is a relatively small number of additional cases because of a new disease has affected the health system so adversely. And that reflects the fact that perhaps we don't have much capacity in the health system to deal with new illnesses. That's a policy choice that we'll have to consider moving forward. I think the other thing to think about as we move forward with the epidemiology is institutions like hospitals and community living centers for mentally, intellectually impaired people. There's the burden of COVID to the extent that it affects people going to the hospital or community members getting sick. And then there's the burden to the community to the extent that there are exposures and people are disqualified from work. And if people are disqualified from work, a hospital can't keep beds open, or it'd be struggling to keep the exact number of beds open. An institution that serves intellectually impaired people will have challenges staffing to provide services for those patients. So I think there's now one additional metric to consider is how does the disqualification of people who are exposed to COVID affect the operation of the institution where these people are employed? So those are things I would consider moving forward.
Will those metrics be included in today's EPI or no? I'm getting the sense, no, not yet.
Well, some of those data elements are there and have been there, but we have to, there are two things I think of. One is I'm hopeful that the province will identify a suite of metrics that we can use to summarize the burden of disease. I think that's recognized by all of our colleagues. And secondly, in the absence of that in the near term or in the immediate term, then I think the health district will have to reformulate its report so to provide those additional insights.
Sorry, go ahead.
I was just going to say, I know you'll all be receiving and we'll be posting the EPI summary. As Dr. Nesathury said, it does represent the previous week, so that December 27th to January 2nd. I think just our caution is that we know, with the delays in testing and results, and we do have some disclaimers on there, just to review the data, with that in mind, that it's a little skewed from previous. And, as far as there's nothing, surprising in there other than, case counts are considerably high, certainly, and everyone has seen that, across the province, but just, to be cautious in reviewing that data.
The other question I had was actually about the safe consumption site. You mentioned, Dr. Nezathuri, that there is a sense of urgency, and you mentioned that across the province we've had 2,500 deaths in the past year because of overdoses, and yet City Council has delayed this now twice. I guess that's got to be very frustrating when you're seeing an opioid crisis like we do, and knowing that the entire process is still months ahead before it's completed, to have this delay from City Council.
Yeah, I'll start. I think, yeah, we're certainly hopeful that, and you know, I will say as well, I mean, the pandemic slowed the process as well. All of you know, and our community knows that the health unit has been working on this for quite some time. You know, we had a plan to complete and submit our application that would have happened in actually our original plan in 2020. And so, you know, obviously the pandemic, COVID-19 pandemic slowed that a little bit, but we did continue to prioritize it. And our team did a great job in keeping it at the forefront, our community partners, and ensuring that we, you know, did the proper consultation, the proper review of sites, et cetera, so that our application, once submitted, will be successful. And so, again, we had hoped, you know, to, as soon as we had finished the consultation on the site, go to City Council, get that approval and submit. And certainly any month, every day is, you know, too long. And so, but we hope January 17th will be our day, and we'll be successful and able to submit and move this as quickly as possible.
Thank you.
Any questions from the Windsor Star?
Yes, good morning. I have a few questions about the enhanced proof of vaccination system. So we know that the health unit is responsible for reviewing people's proof of or medical exemption documents under the new enhanced proof of vaccination system. And then the health unit, if they approve it, enters that into COVAX so individuals can download their QR codes. Just wondering if you have a number or an estimation of the number of exemption requests the health unit has received under the new system.
I don't have the number, but we can get that. I mean, we could share that probably today, you know, via email, Taylor. But I can tell you it's not many. I just spoke with the director yesterday in regards to that, and we have not received many.
Do you anticipate there may be more people out there who would like the exemption than who are aware that they need to apply through these avenues?
So actually, I just was sent a message to say we've received 0. So are there people out there that would like to apply? So the form is, and just as it relates to approval, the health unit just reviews the form. The form has to be completed by a physician. We're just reviewing the form. You know, from an approval perspective, would be that the form is complete. And then, you know, that way it ensures that we can create the profile and the record, you know, in COVAX in the provincial system. As far as individuals are aware, I know all physicians are aware that this exists. So certainly in order to receive a medical exemption, you would need to talk to your physician, and all physicians, you know, the ministry has communicated with all physicians regarding the process and the form, et cetera.
And this question perhaps is for you, Doctor. I've reviewed the list of exemptions as outlined by the province, and there are about a dozen circumstances that are very specific and that would allow an individual to apply or receive medical exemption from their physician. How common are these instances, these conditions, these medical outcomes, and what percentage of the population would you anticipate would actually qualify for such a medical exemption for vaccination?
Well, I think that it would be an exceedingly small percentage of the overall population who would appropriately qualify for an exemption. I can't give you an exact estimate of that number, but it would be very small. more important thing is that if people want an exemption, they would need to be evaluated by their doctor, like anything else in medicine. It's an individual level assessment, and their physician can make that determination. Doctors who complete these documents are required, as an ethical construct, to make a fulsome evaluation and see if people would be eligible for the exemption. But even more importantly, if in fact they're eligible for the vaccine, to get the vaccine, because the most important part of going to the doctor is to try to get better and to stay healthy. And I think that's what most doctors will do, is they will evaluate the patient and make the best possible clinical decision they can when working through that clinical encounter with the patient.
And finally, with enhanced vaccination requirements, proof of vaccination requirements changing, some things come in effect on January 10th, some come in effect already. How does the health unit work to keep businesses informed of these changes? Perhaps that's for you, Nicole.
So changes for, I'm sorry, the proof of vaccination, is that what you said, or just the
Yes.
changes with the measures? I mean, many of the settings that, the requirements related to proof of vaccination, many of those settings aren't open at this point in time, to request that proof of vaccination. But again, I mean, we use all our typical channels, including, the media, our website, and then we do always try, when there's a change in a practice specific to businesses, to share, information via memos, et cetera, either directly through their associations. BIAs are certainly have been great partners throughout the pandemic, as well as the chambers, and as great conduits to make sure that those businesses and organizations that it impacts, receive that information as well. Where there are regulations and changes that are not ours, they're more provincial. Certainly the province is doing their own education and outreach, but we always use our those resources locally.
Thank you both.
Any questions from AM 800?
Nicole, I'm just wondering about the launch of the mass vaccination clinics, how they went yesterday.
I don't have the exact number. I did. I think it was around, for Leamington, I think we vaccinated around just shy of 500 individuals yesterday. I heard it went, really, really well, and I believe, the experience and the site at out in the West End with our partners at Hotel de Grace also was quite successful. So for a first day, so that was great news to hear and really encouraging. And we'll continue to, I think, when I looked yesterday, there were still quite a few appointments, obviously recognizing that those sites just launched. So lots of opportunities for people, but it was a great day. So.
Yeah, I'm on the website right now, and it looks like for the West End site, there's no appointments available until Wednesday. And then in Leamington, there's appointments here and there. I guess, does that show that maybe some individuals didn't have a way to get to Devonshire Mall? They were hoping to get something close to home. So who knows, the goal is this could boost our percentage of vaccinations in our area?
Absolutely, it will boost our vaccination. I think it's certainly more accessible for folks who are living in the West End area and then in the county, and certainly in the area of Leamington. I don't know, it increase any opportunity that increases the number of individuals who could be vaccinated in one day will boost our vaccination rate and get us where we need to be. I think the message is, our best prevention right now for COVID is vaccine, and one of our best tools, and everyone needs to get out there and get their vaccination. And so certainly that means ensuring that they have the opportunity and access for appointments. And I think we're doing a very good job here in Windsor-Essex.
And I just have one more quick question. I'm not sure if my colleagues, if their outlets got calls or if the health unit got calls, but our station got calls, not going to name the business. So we got calls from employees from a big box store. I know we talked about yesterday telling close contacts. The people that called our station are claiming that there's dozens of staff cases at their store. They instructed management to about these cases and how I guess they tested positive, and then management told them not to tell anybody about it. Has the health unit heard anything about this, experienced this? And if this is occurring, I guess what's the health unit's message to employers?
So I can't confirm that rumor, but we do have a complaint mechanism. So, we have in the past and continue to receive complaints, certainly of that nature. If so any individual can go to our website or call us and make a complaint, and we'll do a follow-up if it's something that we are able to follow up on. Our message, and Dr. Necessary may want to add to this, but certainly our message to employers hasn't changed, and they are part of the process for notification. So if they are informed and they need to be part of that process for notifying contacts, they have a responsibility certainly to follow up. And, as I mentioned yesterday, we'll be updating our tools and resources for workplaces, just so that they're, it's as easy as possible for them and they understand what the current guidance is, and they can direct employees or patrons to the right resources. And we'll make sure that we do a reach out and an education related to those tools once they're updated as well. And I'm sure Dr. Necessary will want to add.
Well, what we would encourage is if people have concerns about non-adherence to public health direction to phone the hotline, and we can follow up with that. We can follow up with that to ensure that the proper procedures are being followed at a site of employment or a retail location. But we need to be aware of that, and so we'd ask people to make the phone call.
Thank you.
Any follow-up questions from CTV?
Yeah, just one. You had mentioned that you are considering dropping case counts and moving to a weekly number. Do you have any idea when that might take place?
Yeah, I don't think that's what we meant to communicate. I think case counts at some level will continue to be reported. What I think is that we'd have to consider that when we report case count numbers, they probably are an underestimate of the actual number of cases in the community, to the extent that a lot of people are going to be recognized to have COVID-19 but not get a test. So I think that was our message. And given the fact that we had used case counts as a measure of burden of disease, and now it's likely to not capture in a fulsome way the burden of disease, but we have to look at other metrics moving forward to make those determinations. I hope that makes it a bit clearer.
Yeah, I did think we did say what we are reviewing everything and one, and looking at what we're reporting daily versus what we report weekly is something that we mentioned, and that is still an ongoing discussion. But I don't think as much as possible, if it makes sense and we have information to report daily, we'll continue that.
Okay, thank you.
Any follow-up questions from CBC?
Yes, please. After being one of the worst hit regions for most of the pandemic, Windsor-Essex is now around the 10th lowest out of the 30-odd health units in Ontario for infection rates. We've mentioned numerous times that this is not as reliable as it was before, but do you think it's true that we're actually less impacted by Omicron so far compared to other parts of the province?
Yeah, I think it's premature to conclude that. I would reserve any real judgment on that at this point in time. I think it's if we can maintain our case counts and maintain the burden of disease at the lower end of the spectrum, I think that's great. But I think with all the changes in both data collection as well as with the new variant, I'm not sure we can make any definitive conclusions at this time.
Again, I think it's also important just to note the scale. So, we're talking about still rates per 100,000 that, are 500 to 1,000 at the top end. So the scale, our burden of disease here is still high. It is regardless of, where we are.
Thank you.
Any follow-up questions from Blackburn?
No, I'm good. Thank you.
Follow-up questions from Windsor Star?
No, thank you.
And any follow-up questions from AM 800?
No, thank you. Have a good day.
All right. Thank you very much, everybody. Have a great day and weekend. We will meet again on Monday, January the 10th.
All right. All the best.